And now for a conversation about sustainable solutions to close inequities in maternal health care, please welcome journalist, author, and founder of Birth Fund, Elaine Welteroth, and Dr. Uché Blackstock, author, founder, and CEO of Advancing Health Equity. Here to lead the discussion is Atlantic Live contributor Christina Ruffini.
Start by saying something I think all three of us on this stage believe, and that is maternal health is not just a women's issue. This is a human rights issue. This is a universal issue, right? We all have a mother. It is one of the few things that binds us in these very trying times. And with that in mind, right now in the United States, this is a country with driverless cars and commercial spacecrafts. Women are 10 times more likely to die in childbirth than in other industrialized nations. And when you drill down even further into those numbers, Black women are 3 to 4 times more likely to die during childbirth than white women. Women over 40, 6 times more likely to die giving birth. So we want to talk about how we got here, what we can do to help. Both our panelists today are trying to tackle this issue with realistic and, yes, optimistic solutions-based outcomes to ensure that more families, no matter where they come from or what they look like, get to celebrate a happy first Mother's Day. So, Dr. Uché, I'd like to start with you. Because I am a giant nerd, I was recently reading about the history of healthcare in the US, and I didn't realize that at the turn of the 20th century, there was an organized campaign by the growing medical industrial complex to take the birthing experience out of homes, out of the hands of experienced midwives, and move it into a clinical setting. I know you talk about this in your book. Can you tell us a little bit about that history and how it's still impacting maternal outcomes?
Sure, and I'd like to ask anyone in here, have you heard of the Shepherd-Towner Act? If you have, raise your hands. Okay, so a few people have. And so this act is one of the reasons why we have so few midwives in the United States. And we know that midwifery-centered care actually improves health outcomes. So the statistics that Christina mentioned at the beginning, in terms of how the United States compares to other industrialized countries and high-income countries, one of the main reasons is because our obstetrics care, our care of birthing people is not centered around midwife care. And so the Shepherd-Towner Act was an act in the early 1920s that was actually pushed by the American Medical Association, which is our oldest and largest organization of physicians. And essentially, it was a campaign that advertised that midwifery care was unsanitary, unhygienic. It was associated with worse outcomes. And many of you may not know, but most birthing processes, deliveries all around the world, including in the United States, were done by midwives or birth workers, as we call them, up until the turn of the century. This act actually, unfortunately, erased midwives in our country and made it more difficult for midwives to become certified, decreased the number of midwives because that certification process became more cumbersome, and then also medicalized the process of giving birth. And as Christina mentioned, transitioned the care of people giving birth from their homes to in the hospital when it wasn't necessarily indicated.
And that's still impacting maternal outcomes today, right?
Oh, absolutely. One of the other reasons why we have high maternal mortality rate is because we have increased complications. We have the highest C-section rates, some of the highest episiotomy rates. We have a lot of negative outcomes that are actually, and I'm a physician, so I'm speaking from the perspective of a physician, but I've also been a patient. But this history is really important to understanding how we got to where we are in 2024, where as a country where we spend the most on healthcare, on maternity care, but we have maternity deserts, and we have actually women of all racial demographic groups with the worst health outcomes and maternity outcomes as well.
Elaine, I want to ask you, 50% of new moms in this country describe their birth experience as traumatic. Does that surprise you? And what about your experience when you had your first child made you want to get involved and start the Birth Fund?
Well, first of all, hello everyone. Really excited that we have the opportunity to even talk about this issue on a stage like this, because I do think that maternal health, like women's health, has been marginalized and put into the shadows, and it's very low on the cultural agenda. And I'm very glad to see that we're giving it the space it deserves, especially as a pregnant woman, 33 weeks pregnant today.
And still wearing heels, so.
Only in heels for you all. They will be coming off right as soon as I walk off the stage. That's traumatic, actually, is heels on pregnant women. But when I will tell you as a journalist, first and foremost, that I was aware of the maternal mortality crisis, the Black maternal mortality crisis, the disparity, 3 to 4 times, Black women are 3 to 4 times more likely to die during and after childbirth. These are statistics that you're sort of inundated with, but it becomes very real for you in a different way when you become pregnant in this country and you set out to find a doctor to give birth with. And I went in woefully unprepared, woefully overconfident about how easy that process would be. I thought, how hard is it to find a doctor?
Women give birth every day.
Women give birth every day. I'm gonna go to a hospital, I'm gonna find a doctor, go to the hospital, have a baby, probably get the epidural like everyone else I know, and it'll bada boom, bada bang. Done a lot of hard things in my life, how hard could this be? Turns out a lot harder than I thought to find the kind of quality care that I came to expect from someone who I'm putting my life in, someone who I'm trusting with my life and my child's life, especially in the context of a maternal mortality crisis. The reason that I started Birth Fund is because I deeply believe that we have to stop talking about this problem through the lens of the alarming statistics alone and the problem itself, and we need to shift the narrative to talk about solutions. Because one of the things, as I went through this process of dating doctors and being deeply disappointed in the care that I received, I felt that they were demeaning. I felt they were condescending. I felt that the system itself was not set up to provide holistic, quality care. Visits were 15 minutes. You're rushed in and out. I was told I was asking too many questions. I was told I was actually, have they met journalists? But I was told I had exceeded the 3 to 4 question max per visit. I had a doctor stand up and walk out on me. I mean, I had someone say, I don't know what you think this is. You can't just walk into a hospital, pop a squat, and have a baby. Everyone needs interventions. So the kinds of experiences I was having, I actually thought I was being punked, but as a journalist, I put on that journalist hat to try to understand what was happening to me, and more broadly, what is happening to us. And one of the things I love that you say is that how you measure the health of a nation is by measuring how well you treat its mothers and its children. That is a Dr. Uché quote. And I realized we are deeply unhealthy, but I wanted to understand why. I am not anti-doctor at all, but this system is broken. And that I say that from a position of privilege, with access to the best doctors, the best hospitals, the best healthcare. I have a great network of folks and resources to help guide me along this journey. I could not help but imagine what my experience would be like if English wasn't my first language, if I did not have access to healthcare. So it was very easy for me to understand, actually, once I was entered into the system as a new mom, exactly why the death rates are what they are, exactly why even if you survive birth, you come out with birth trauma. 50% of families say that they have had birth trauma. I understand it now, and I feel incredibly lucky that I was redirected to midwives. Shout out to Kindred Space LA and the Black midwives, who are they own the only Black-owned birth center in all of Southern California, which speaks to the dearth of birth centers in this country. But I was redirected into the care of midwives who completely transformed my understanding of what birth could look like in this country, but all across the world. And they also educated me about why we have the worst rates across the board. When you look at all industrialized nations, one of the things I want to lift up, why are we talking about midwives so much? I think we need to...
I want to ask, I have seen several episodes of the BBC historical drama called Midwife. So I am basically an expert. However,
I don't want to skip over. Many people in the room might not have seen those episodes.
I'm a Harvard-trained physician on the couch.
Yes.
I'm going to defer to Dr. Uché and say, what is a midwife? How are they different? What is the service, and why does it make such a difference?
Before we do that, I think really quickly, and sorry, because you are moderating and I am not, but I do want to say this. The reason we are talking about midwifery and the reason that Birth Fund lifts up midwifery as a solution to this crisis is what we know is that 80% of the maternal deaths in this country are preventable, and we know that they can be prevented with midwifery care. So my question is, why are we not investing more in midwifery care? Why are we not doing more to change the narrative, the false narrative, and the stigma around midwifery care? And what are we doing to save the lives of families by making sure they know that they have more options than the ones that are right in front of them? So I just wanted to
No,
say
that's
that.
fine. And that stat, I mean, that stat's from the WHO.
Yeah.
And there's another 2016 study published by the Corcoran Review said basically that pregnancies that involve care from midwife had better birth outcomes than those without the services. So doctor, what are the services that they provide?
Right, and so I want people to understand, I think people know a lot about like what physicians do, right? We go to medical school, then we do a residency, then we specialize in something. And I'd like to say that, obstetrics gynecologists, they are specialized in dealing with particularly high-risk pregnancies, and also pregnancies that require interventions within the hospital. But the fact is that the majority, especially of first-time births, don't require in-hospital deliveries. But the fact is that we've been sort of brainwashed to think that's the case. We think that's the norm. And even myself as a physician, I'm an emergency medicine physician, and I've always seen the worst outcomes of home births. Right?
Because that's who gets to you.
That's who gets to us, right? And I would hear my OBGYN colleagues say, I can't believe they decided on a home birth. But the fact is that people should know what their options are, right? There's home births, birth centers, and in hospital. They should also know what their medical professionals do. So I think it's important for people to understand that midwives are licensed professionals. There are different types. Some complete a nursing degree and then a master's in midwifery. Some are certified professional midwives who have a different type of certification. But it all depends actually on what state you live in. Unfortunately, the current model requires sometimes for midwives to have a physician supervising them. But that also can be important because the collaborative care is important. If there is a delivery that goes awry and needs an OBGYN, the OBGYN is there and they have admitting privileges to a hospital. But I think it's important for people to understand is that most first-time births actually can happen at home. And that's something that I did not know. Midwives weren't even part of my medical training. I only thought you could go to an OBGYN. Yeah. And when I think about when I had my kids at 37 and 39 years old, and when I reflect back on all the data that I have now, we're talking about the Commonwealth Fund. They came out with a study today talking about how the US, we really have like the worst health outcomes overall, even though we spend the most on health care. But one of the reasons is, for the maternal health outcomes, the poor ones, is because we don't have midwifery-centered care. We don't have postpartum support.
But what are the midwives offering that you can't get?
Yes.
So is it that postpartum care? Is it that you can ask more than your allotted 3 questions?
Well, I think 2/3 of maternal deaths happened in the postpartum period. And so if there's this model of holistic care, there's this continuum of care that starts even before someone gets pregnant. Most people in the current model, they'll have one visit at 6 weeks after giving birth, and that's it. Most industrialized countries, you have one visit in the first week, and then you have multiple other visits. So that midwifery model is a very affirming model. It actually encourages patient autonomy, shared decision-making. But also there's more postpartum support. And we know because the causes of those deaths occur in the postpartum period, you need someone watching over you. Yeah. You need someone supporting you. You need someone to say, to you, I'm not feeling good, or I noticed your legs are swollen. So there's that sort of medical support, but there's also more holistic support of the whole being, I think. And I'm sure, I know Elaine can talk from experience.
Well, just from a patient perspective, I can tell you that it's the difference between 15 minutes with your doctor being rushed in and out and an hour or more at your bedside. It's the difference between one visit 6 weeks after you give birth and a home visit the next day, 3 days later, the week after that. They see you multiple times in the first 6 weeks. And I can attest to, I think it's important that we break down these stats in personal stories. I could have been a statistic. 12 days postpartum, I woke up at 5 a.m. with a strange feeling in my leg. And something crossed my mind. Is this a blood clot? Strange maternal instinct that popped up there. And I thought, I almost disregarded the thought, but I texted my midwife, explained to her what I was feeling. She said, get out of bed right now and go directly to the ER. That is a DVT. Go to directly, it's life-threatening. You need to go right now. And I was like, no, I hate the doctor. What if it's just a Charlie horse? Like, oh. But because of the trust
she knew you and you knew her.
She knows me. I have direct access to her in a way that we don't have access to our doctors. We have a trusting relationship built up. And when she told me to get out of the bed and go to the doctor, to the ER, I went. And I was immediately diagnosed with not one, but 2 life-threatening DVTs. That if they were not caught, who knows if I would be sitting here today. And so I deeply believe in the holistic care model, the wraparound care support that you get through midwives, and I want more families to have access to that if they want it. Not every family is the right candidate for midwifery care, but to your point, most births, if they are, if they're normal, healthy births, can be birthed with a midwife. And there's just so much unlearning we have to do around the norms, around pregnancy, childbirth, and what to expect for when it comes to the postpartum stage. And so why I started Birth Fund was to expand access to midwifery care for families who don't have access to the funds that cover the out-of-pocket costs. Because the thing to point out here is that in America has, you've pointed out, it's 10 times deadlier to give birth in America than it is in any other industrialized Western world. Western country. So, forgive me. Industrialized country, thank you. Pregnancy brain, I can always blame it on that. But when you look at why, midwifery is the default care model in every other wealthy country in the world, except for here in America. And midwifery isn't even covered by insurance here. But we know that it's a solution that would work to help save mothers. So until the government catches up, until insurance companies wake up, we have to do something now. Because especially in this moment, when reproductive rights are being rolled back, we have to understand there's going to be a direct correlation between the legislative changes that are happening, that are stripping women of their reproductive rights, and a sharp increase in maternal deaths. We are forcing women into motherhood before they're ready, which means we're also forcing them into a deeply broken maternal health care system. There's an urgency to this work. And so Birth Fund is here to raise funds for direct grants that go to families who are pregnant right now, who need support right now in real time. And I will tell you, in our first cohort, some of the families that we supported told us if they did not get the funding that they received through Birth Fund, they were going to brave childbirth at home alone. Because these are women who are that afraid of going into the hospital, or who lived in healthcare deserts, healthcare deserts. Do you know how alarming that is? That we are in 2024 with, as you said, all of these technology advancements. I live in LA and I watch these robots deliver food. How have we not figured out how to keep women alive through childbirth when we're forcing them into motherhood?
I know. And
there's more we can do.
Yeah.
we're running a little short on time, but I want to make sure we get to why this issue so disproportionately impacts Black women.
Sure.
And before I did this panel, I had assumed, without doing my research, that it was tied to socioeconomics like so many other issues. But it's really not. A wealthy Black woman is more likely to die in childbirth than a poor white woman. Is that accurate?
Yes, and I know Elaine has heard this, but can I just say, so it's midwifery-centered care, postpartum support, paid family leave, and universal health coverage. So those are all the reasons why other industrialized countries have improved health outcomes compared to us. And then when you add that plus systemic racism, it's even more difficult on Black women being pregnant. And so I always say that, I know Elaine's heard this, but even myself as a Harvard undergrad and Harvard Medical School graduate, I still am 5 times more likely to die of pregnancy-related complications than a white woman with an 8th grade education. And people would say, well, why is that?
Why is that?
Why is that, right? And a lot of it is because of interpersonal racism. We know that Black patients often get spoken over during clinical interactions. They do not get listened to. We do not get listened to. I've been, as a patient, our concerns are minimized, and we've seen that with, very famous Black women like Serena Williams, right, who is a professional athlete and knows her body very well. And then there's also the systemic aspect, so that even socioeconomic status is not protective, that even dealing with everyday racism actually causes a chronic wear and tear on the body. Some of you may have heard of weathering by the public health researcher Arlene Geronimus, but that predisposes us to chronic conditions that may make us even sometimes, some of us, less healthy going into pregnancy. So pregnancy is a stress on the body. So we cannot underestimate the role of both interpersonal and systemic racism on Black women in this country. But again, I want to just emphasize that when we look at maternal health outcomes for women of all racial demographic groups in this country, all women, even white women, their maternal rate is even worse than some lower income and middle income countries. So this is a problem that everyone should be concerned about, that giving birth really should be a joyful period. But in United States, we have so much work to do. A lot of it is around policy, right? So making sure that people have coverage for midwives and doulas, that we have paid family leave, that everyone has access to universal health care. This is not rocket science, right? This is something that other countries are doing, and they are doing very, very well.
All right, so we've only got a few minutes left, but I want to say, what is the best advice you could give to someone who is pregnant or planning to become pregnant about how to advocate for themselves, how to find the right doctors? And what would you say to someone who is sitting here listening to this conversation and is afraid of having a baby in this country?
Well, I would say that, you have to know what questions to ask. Make sure that you are talking to a wide array of maternal health providers, whether they are doulas, midwives, physicians know what each of those roles are. Know that, in terms of your health status, are you someone who is appropriate for an at-home birth or birth center or in a hospital? I also want to just give a shout out. There are lots of resources out there by women, by Black women finding solutions. So there is an app called the Earth app. I always want to shout it out, IRTH. It's about basically like a Yelp directory for maternal health providers and hospitals. People put reviews on there. And just talk to your community, right? Talk to your village to get recommendations for, who you've had a positive interaction with.
Yeah, I would underscore everything that you just said. And I think you have to listen to your body when you feel unsafe. Sometimes you need to encourage yourself it's okay to trust that and to make a different choice, and to, for a lot of people, it's difficult. If you do not have the time to find another doctor, many women will choose to stay and just accept the status quo. And I just want to say to anybody who is pregnant or scared of having children, know that there are better options out there, and it is up to unfortunately, it's up to us to find the better care that we deserve and to advocate for ourselves. And I do think that knowing what questions to ask is incredibly important. How do you find that out? Well, part of, again, I'm not trying to shamelessly plug Birth Fund, but part of what our work is to fill the gaps, because even as a...
Because it's not getting done
It's
otherwise.
not getting done, and there's too much of this burden is being placed on mothers and pregnant people who already are burdened enough.
Mom's got enough to do.
Mom's got enough to do. So I think that we need to do a better job as storytellers of bridging the gap to help women feel more informed and educated and empowered going into motherhood. I feel, really responsible for helping to, a big part of this problem is just access to information, access to funding, access to better care, access to the questions to ask. And so part of what we're focused on, in addition to direct funding for families in real time, is also a narrative and cultural change initiative to really rebrand birth in America and help women understand the agency that they have. And I'm very honored that you mentioned Serena Williams, and I also want to shout out Dr. Uché, who's one of our medical advisors for Birth Fund. We need to do this work together as a coalition with medical professionals, with people like Serena Williams, who was the one who opened my eyes to the maternal mortality crisis long before I was thinking about children. And that's why she was one of the first people I called on to become a funder for families through Birth Fund. And she said immediately, yes, and then said, you need to call my husband next. That's the next phone call you need to make. And I called Alexis, and he immediately said yes. And what we need, I'm so heartened that there's many men in this room. I don't know if you signed up for this or you just ended up here because you were watching something before, but we need you. We need you too, okay? Like, this is not, there's a lot of, I will say this, I love Beyonce and I'm an independent woman. There's a lot women can do on our own, but giving birth to a child in this country safely is not one of them. We need our partners' support. We need men and dads activated around this, because make no mistake, no one is more impacted by this issue than the dads that come home from those hospitals without their partners and are left to raise those children on their own.
Takes a village to raise a kid, and it's going to take a village to fix this issue.
Absolutely. Way to wrap it up.
Yeah.
Way to land the plane.
That's why they pay me the mediocre bucks.
Thank you so much.
Thank you both so much. And thank you all. Again, there's a lot of people here from a lot of different walks of life, and I really appreciate everybody coming to listen to this issue, because it is something that impacts all of us. And hug your mom if you still can. Thank you so much.
Thank you.
Thank you.